Joining us in the studio now from the Tribal Health Maintenance Program with Cocopah, we have Elizabeth Garcia and Jessica Serrano. Thanks for joining us.
Thank you.
Good morning.
All right, well, we have you here today because we understand, Jessica, I know you received the COVID-19 vaccine.
Yes, I did.
Did you also?
Yes.
Okay. When did you receive those?
We received them
December, a couple weeks ago.
Yeah.
Okay.
Okay, so you were one of the first to actually get the vaccine.
Yes.
So why don't you guys tell us about your experience?
Okay, well, I was the first tribal member to go in. So it was a really easy, fast experience, just like a flu shot. And yeah, it wasn't really anything different, anything new, but it was cool to be the one of the first, yeah.
I know we have been seeing some of the frontline healthcare workers that have been sharing the follow-up experience because people naturally are very curious about any type of symptoms you may develop or reactions, side effects to receiving the vaccine. And have either of you experienced anything?
Yeah. So when we got the vaccine later in the day, and that evening I felt a little bit of like a migraine, just really some fatigue. But the next morning it was all gone. So.
Mine was just a sore arm, same as I usually get for a flu
Like
shot.
the flu shot?
Mhm.
That's what I experienced when I got mine. But what we have been hearing from some people that they are mild side effects for 6 to 12 hours.
Mhm.
That would kind of be the case with you following,
Exactly.
since it was administered later in the day too. All right, but you have to go back for the second round.
We do.
Is it within 28 days?
21
days.
days.
Okay.
So you'll be getting the second round, and I'm glad that we do have a lot of our healthcare professionals that are sharing their journey, and I'm glad that they are because I think it's putting some ease to people's fears. It was developed quickly, and it needed to be developed quickly. So a lot of people are skeptical on whether they want to get it or not. Are they going to wait a little longer and then get it? But seeing our frontline workers, our healthcare professionals, and all of you guys getting your vaccines first kind of gives me a reassurance. Okay, if my healthcare professional friends, family, and community are willing to do it, then I feel safe doing it.
Exactly.
Yeah, and I think that's how a lot of our tribal members are feeling now that we were just recently talking to a good group of tribal members, and that's something that we brought up was that we were some of the first to get the shot. And I think it did put their mind at ease to know that. They're like, oh, someone just like me is getting it. Not just, people we don't know are getting
Exactly.
it.
Exactly.
People in the spotlight, maybe at the national level or international level. It's people that they know and they can reach out to if they do get it and say, Jessica, this is what I'm experiencing. You're like, oh, that's what I had too.
Yes.
And right.
And it's nice that both of you have a different experience too.
Exactly.
Because I know that me, especially, I've gotten the flu shot the last couple of years, and again, sore arm, nothing major, but there is people that have different experiences, even with just a flu shot. So and they say there is side effects. They're mild and they will subside, but people automatically worry, oh no, I'm feeling this way. What does this mean? So it's kind of nice that you have both situations here.
And we do have a lot of people that were concerned, obviously, because it is something that was fast-tracked. But looking back, people say it traditionally takes 7 years for a vaccine really to come to market. We had the brightest and greatest minds of the world working together collaboratively to make this happen. And thinking back to the polio vaccine back in the late 40s, I'm thinking, you didn't have the networking and the communications like we do now for people to work on things from different locations in a timely manner and communicate. So, the fact that we have technology that we do today also certainly makes a huge amount of difference. And I see that the third vaccine is coming to the market. Was that the AstraZeneca?
I believe so.
I'm not
Okay.
familiar with that.
I think that's launching in England. Okay, these are tidbit news
I'm
here.
like, I don't know that one for sure.
That might still be a little while.
But
Yeah.
but there's different companies that are putting out their vaccines. So it's technology. We're thankful for it. But again, it's still a little scary. So to have you guys going out there and putting yourselves out there and saying, look, it's fine. We're going to be okay. I think the biggest challenge is going to be, and I don't know about your guys' situation on the Cocopah reservation, but I think the biggest challenge is people are going to be like, I got my vaccine, I'm good to go, but again, there's still a large population that may not get it because whether they're scared or whatever reason, but also our kids, you know, the vaccines aren't recommended and licensed yet for our kids under 18.
Exactly. And I think for our program, right now what we're focusing on is because we know that the vaccine isn't for our little ones, we're really just trying to promote that information of, if, you know, go to your well child checkups every year, you know, get that relationship with your primary care doctor, so that if your child is feeling sick, you know, we can do that, knowing that we're not going to be able to have the vaccine for them right now.
Right, and that's why we need to continue as a community doing our part with the social physical distancing, the masks, and all of those steps, because it will still be a while before the individuals in our community are vaccinated. There's that rollout process. We're on the first batch of the frontline healthcare workers. We're going to move on to the essential services and our vulnerable populations and nursing homes. There is a rollout phase, but a lot of people are like, well, this is what I do, where do I fall in? So I'm trying to get information, because we had the essential list of employees put out by the governor's office last year, and it's a slight variation on the different categories for that. And they're like, well, okay, I'm essential, but am I essential frontline?
Exactly.
Okay, so I'm sorry, you get into that whole, I'm this now. So, but the important thing is we're still looking at probably summer of 2021 by the time we finish rolling out the initial vaccine for the individuals in our community. So we will, you know, not everyone. I know there are some people that thought, oh, the vaccine's available, finger snap, things go back to how they were pre-2020. That's not the case. It's going to be a process.
Yeah.
Is your guys' process on the reservation pretty much the same as everyone else's as far as who's getting it when?
Exactly.
Yes.
You're following it the same way? Perfect. I think it's important. It's a scary situation. COVID in itself is a scary situation, but now we actually have a vaccine. That itself is scary, and there are people that are scared. So I do thank you for putting yourself out there, really, and sharing your stories with everyone. And like you said, you know, it gives some sense of calm knowing someone just like me got it done.
Yes.
And James does have a question on our Sunset Health Facebook live feed. He says, how about people that are resistant due to blood type like me? Any idea
Has
about
that even
that?
been proven?
I don't know.
I don't know
Well,
either.
I haven't heard anything about
haven't
blood
either.
type.
All right, maybe he has a response to certain vaccinations.
Could be.
And maybe it's previous experience. All right, well, we'll look into that for you and see what we can find out.
Yeah.
Oh, he said, my blood type is resistant to COVID. I'm not going to get the vaccine until next year. So
I have not heard anything like that.
I will chat with you later. I want to make sure that he's receiving, you know, where he's getting his information too.
Exactly,
Yes.
because again, there's a lot of information out there, and you have to be careful where you get your information.
Yes.
And we don't want people to think that they're COVID resistant and not taking the precautions,
Yeah.
and then
Have them
have them getting sick or taking it home to their vulnerable family members. So
All right. Well, great information, ladies. Thank you so much for sharing with us today and letting us know about your experiences. That is important that we continue to spread the word to other people, and you know you're still able to function and go about your day-to-day work, and they can still get a flu shot.
Yes.
do you guys provide flu shots at your facility?
We do not, no. We would just refer them to the Indian Health Services or to a clinic here in town.
Yes.
Perfect.
All right. I went to one of the grocery stores and I was in and out in
In and
7
out.
minutes.
Quick.
Awesome.
So, well, all right, thank you so much for joining us today.
Thank you so much.